My name is Dr Nokukhanya Ngubane-Mwandla. I'm a pediatric nephrologist and I'm based at Nelson Mandela Children's Hospital. As a nephrologist, I must say kidneys are not well known in terms of causing disease amongst the general population. So our role as nephrologists is to pick up these children who are usually referred to us with kidney problems and try and manage them and try and control the kidney disease as best as we can. Kidney disease is one of the most important conditions and public health issues in South Africa, especially that globally, even WHO is trying to push it up in terms of being known as one of the important, being in the top 5 causes of mortality in children as well as adults. So it is a global health emergency as well, adults as well as children, because if it's not picked up early, then it causes severe morbidity, severe also mortality, and through morbidity, then the health economy expenditure also increases, especially if the condition is picked up late. It is a silent disease because its onset is very what we call insidious. So you may find that the child goes on normal life and nice and healthy, goes to school and stuff. Then all of a sudden the parent complains that the child is tired or is not eating well, the appetite is gone, or maybe just has a bounce of blood in the urine, and then that's when usually the referring doctor either does a urine dipstick test or does a general examination and ultrasound, and then that's when we pick up that no, this kid actually has got a kidney disease. In children, what we see commonly is conditions such as glomerulonephritis or nephrotic syndrome, which is conditions which affect the kidney itself. And then also we see congenital abnormalities of the kidney and urinary tract, where a child gets born with abnormalities within the tract, and then that progresses and causes a child to also have chronic kidney disease, or can lead to that as well. Once you've been diagnosed with kidney disease, it's very important then to, usually a nephrologist, we always refer the patients to a dietitian, and then who will emphasize on like low salt diet, especially if you've got high blood pressure or certain conditions like nephrotic syndrome. But once you start progressing to chronic kidney disease, then we also encourage staying away from food that is rich in what we call phosphate. So that includes dairy products, unfortunately, and some processed food, which is not nice for the kids, but yeah, the parents usually are quite on board. And also food that is rich in potassium, such as even strawberries and oranges, potatoes. So all these things we need to just work around, and like we can tell a parent to do a certain thing before they eat the potato, like soak it and stuff. So those are 2, because the kidneys, once they stop functioning or not functioning well, because one of the functions of the kidney controls water, controls salt, controls all your electrolytes, your potassium, your phosphate. It also controls your blood. So the last product that needs blood to be formed is produced in the kidney. So if the kidney is not working, we need to then start supplementing, giving iron tablets, sometimes blood transfusions. Kidney replacement therapy, we offer hemodialysis, peritoneal dialysis, And then with and sometimes the child or an adult may need continuous renal replacement therapy. So those are all dialysis, meaning that we are treating. However, there is conditions where the child, after a multidisciplinary meeting with the parents, they opt for conservative kidney management, which means almost like palliative care for the child, for the adult. So peritoneal dialysis in children is the first mode, which is a tummy dialysis, first mode and first choice for children. Because it's very gentle, and the children can still go to school, they can do it at home, and they just come once a month just for follow-ups. So most children who end up on hemodialysis, which is the blood one, have actually failed the peritoneal dialysis, and then they end up on hemodialysis, and all of this is all temporary. The whole aim is to kidney transplant. That's where we are aiming for, all while we do the dialysis and stuff. Yeah. And through epidemiological studies, then we can try and convince the government that kidney disease is real and it's making a major impact globally, as well as especially in Africa and sub-Saharan Africa. So that's research is currently underway, and ICN is also encouraging, with the Global Atlas, contributions from everywhere globally in Africa and every sub-Saharan, everywhere in the world, to put together data so that to raise awareness and to actually equalize kidney management for children with kidney disease. Then there's research, especially with the adults, and then we kind of tag on as well with SGLT inhibitors and all the other nice stuff to try and slow down kidney progression in adults. and children. We're still doing those studies. For an adult perspective, I mean, look after yourself, drink lots of fluid, stay away from salt. And then if you're feeling tired, you're not well, check your sugar as well. So through controlling those aspects, then you can also control the kidney disease. In children, screening, I would encourage what we call antenatal screening during pregnancy, so they can even check the kidneys and see what's happening. And then if your child is unwell, just ask them to test the urine. Just do the urine dipstick. The doctor can just test the urine, and that's all. And then blood pressure as well. I'd love to get that out there in the public.